Hey, Alpha Nurses, I'm Licensure from AlphaNursGuide.com. This is 20 practice NCLEX questions. Without the way, let's get started.
A client is to receive EPOIN injections. What laboratory value should the nurse assess before giving the injection? 1. Hematocrit. 2. Partial thromboplastin time. 3. Hemoglobin concentration. 4. Prothrombin time. The correct answer is 1. EPOIN is a recombinant DNA form of erythropoietin, which stimulates the production of red blood cells and therefore causes the hematocrit to rise. The elevation in hematocrit causes an elevation in the blood pressure. Therefore, the blood pressure is a vital sign that should be checked. The partial thromboplastin time, hemoglobin level, and prothrombin time are not monitored for this drug.
The nurse is caring for a client who has just had an upper GI endoscopy. The client's vital signs must be taken every 30 minutes for 2 hours after the procedure. The nurse assigns an unlicensed nursing personnel to take the vital signs. 1 hour later, the UAP reports the client, who was previously hay-febrile, has developed a temperature of 101.8 degrees Fahrenheit. What should the nurse do in response to these reported assessment data? 1. Promptly assess the client for potential perforation. 2. Tell the assistant to change the thermometers and retake the temperature. 3. Plan to give the client acetaminophen to lower the temperature. 4. Ask the UAP to bathe the client with tepid water. The correct answer is 1. Promptly assess the client for potential perforation. A sudden spike in temperature following an endoscopic procedure may indicate perforation of the GI tract. The nurse should promptly conduct a further assessment of the client, looking for further indicators of perforation, such as a sudden onset of acute upper abdominal pain, a rigid, board-like abdomen, and developing signs of shock. Telling the assistant to change the thermometers is not an appropriate action and only further delays the appropriate action of assessing the client. The nurse would not administer acetaminophen without further assessment of the client or without a physician's prescription. A suspected perforation would require that the client be placed on nothing-by-mouth status. Asking the assistant to bathe the client before any assessment by the nurse is inappropriate.
After the administration of TPA, the nurse should 1. Observe the client for chest pain. 2. Monitor for fever. 3. Review the 12-lead electrocardiogram (ECG). 4. Auscultate breath sounds. The correct answer is 1. Observe the client for chest pain. Rationale: although monitoring the 12-lead ECG and monitoring breath sounds are important, observing the client for chest pain is the nursing assessment priority because closure of the previously obstructed coronary artery may recur. Clients who receive TPA frequently receive heparin to prevent closure of the artery after administration of TPA. Careful assessment for signs of bleeding and monitoring of partial thromboplastin time are essential to detect complications. Administration of TPA should not cause fever.
The nurse is preparing an amnio infusion for a client who is experiencing severe variable decelerations of the fetal heart rate. Which solution should the nurse expect to administer through the intrauterine pressure catheter? Select all that apply. 1. Normal saline. 2. 5% dextrose in water. 3. Lactated Ringer's solution. 4. Albumin 25% solution. 5. Dextrose and saline. The correct answers are 1. Normal saline and 3. Lactated Ringer's solution. Normal saline is used in amnio infusion. It can cause slight changes in fetal electrolytes, but is an acceptable fluid. Lactated Ringer's solution is the preferred fluid for amnio infusion. 5% dextrose in water is not indicated for amnio infusion. Albumin is a blood product prepared from plasma and is not used for this procedure. Dextrose and saline is not indicated for amnio infusion.
The charge nurse is assigning the nursing care of a patient who had a left below the knee amputation 1 day ago to an experienced nurse who will function under the lead nurse's supervision. What will the lead nurse tell the experienced nurse is a major focus of the patient's care today? 1. To attain pain control over phantom pain. 2. To monitor for signs of sufficient tissue perfusion. 3. To assist a patient to ambulate as soon as possible. 4. to elevate the residual limb when the patient is supine? The correct answer is 2. To monitor for signs of sufficient tissue perfusion. Rationale. Monitoring for sufficient tissue perfusion is a priority at this time. Phantom pain is a concern, but is more common in patients with above-the-knee amputations. Early ambulation is a goal, but at this time, the patient is more likely to be engaged in muscle-strengthening exercises. Elevating the residual limb on a pillow is controversial because it may promote knee flexion contracture.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The nurse is conducting a community presentation on the early detection of colon cancer. Which of the following should the nurse encourage members of the audience to report to their healthcare providers? Select all that apply. 1. Fatigue. 2. Unexplained weight loss with adequate nutritional intake. 3. Rectal bleeding. 4. Bowel changes. 5. Positive fecal occult blood testing. The correct answers are 1. Fatigue. 2. Unexplained weight loss with adequate nutritional intake. 3. Rectal bleeding. 4. Bowel changes. And 5. Positive fecal occult blood testing. Colorectal cancer may be asymptomatic, or symptoms vary according to the location of the tumor and the extent of involvement. Fatigue, weight loss, and iron deficiency anemia, even without rectal bleeding or bowel changes, should prompt investigation for colorectal cancer. Fecal occult blood testing commonly reveals evidence of carcinoma when the client is otherwise asymptomatic. When administering a blood transfusion to a patient, which action can the nurse delegate to the assistive personnel? 1. Take the patient's vital signs before the transfusion is started. 2. Ensure that the blood is infused within no more than 4 hours. 3. Ask the patient at frequent intervals about the presence of chills or dyspnea. 4. Assist with double-checking the patient's identification and blood bag number. The correct answer is 1. Take the patient's vital signs before the transfusion is started. AP education and role includes obtaining vital signs, which will be reported to the nurse before the initiation of the transfusion. Monitoring for transfusion reactions, adjusting the transfusion rate, and ensuring that the blood type and number are correct require critical thinking and should be done by the nurse. The client diagnosed with a stage 2 pressure ulcer is prescribed a hydrogel dressing. Which statement indicates the client understands the teaching about the hydrogel dressing? 1. The hydrogel dressing is soothing and reduces pain. 2. It must be used because my pressure ulcer drains a lot. 3. This dressing can only be used if my wound is not infected. 4. This dressing is very difficult to apply and remove from the wound. The correct answer is 1. The hydrogel dressing is soothing and reduces pain. Hydrogels help maintain a moist healing environment, granulation, and epithelialization, and they facilitate autolytic debridement. One advantage of a hydrogel dressing is that it is soothing and reduces pain. One of the disadvantages of hydrogel dressings is that they are not recommended for wounds with heavy exudate. An advantage of using hydrogel dressings is that they can be used when infection is present. An advantage of using hydrogel dressings is that they are easily applied and removed from the wound. A school-aged child has been diagnosed with strep throat. The parent asks the nurse when the child can return to school. Which is the nurse's best response? 1. 48 hours after the first documented normal temperature. 2. 24 hours after the first dose of antibiotics. 3. 48 hours after the first dose of antibiotics. 4. 24 hours after the first documented normal temperature. The correct answer is 2. 24 hours after the first dose of antibiotics. Children with strep throat are no longer contagious 24 hours after initiation of antibiotic therapy.
A client has been diagnosed with vasospastic disorder, Raynaud's phenomenon, on the tip of the nose and fingertips. The physician has prescribed reserpine to determine if the client will obtain relief. The client often works outside in cold weather and also smokes 2 packs of cigarettes per day. Which of the following should be included in the discharge plan for this client? Select all that apply. 1. Stopping smoking. 2. Wearing a face covering and gloves in the winter. 3. Placing fingertips in cool water to rewarm them. 4. Finding employment that can be done in a warm environment. 5. Reporting signs of orthostatic hypotension. The correct answers are 1, 2, and 5. Vasospastic disorder, Raynaud's disease, is a form of intermittent arteriolar vasoconstriction that results in coldness, pain, and pallor of the fingertips, toes, or tip of the nose, and a rebound circulation with redness and pain. The nurse should instruct the client to stop smoking because nicotine is a vasoconstrictor. An adverse effect of reserpine is orthostatic hypotension. The client should report dizziness and low blood pressure, as it may be necessary to consider stopping the drug. The client should prevent vasoconstriction by covering affected parts when in cold environments. The nurse can teach the client to rewarm exposed extremities by using warm water or placing them next to the body, such as under the axilla. It is not realistic to ask this client to change jobs at this time.
Which of the following lipid abnormalities is a risk factor for the development of atherosclerosis and peripheral vascular disease? 1. Low concentration of triglycerides. 2. High levels of high-density lipid cholesterol. 3. High levels of low-density lipid cholesterol. 4. Low levels of LDL cholesterol. The correct answer is 3. High levels of low-density lipid cholesterol. An increased LDL cholesterol concentration has been documented as a risk factor for the development of atherosclerosis. LDL cholesterol is not broken down in the liver, but is deposited into the intima of the blood vessels. Low triglyceride levels are desirable. High HDL and low LDL levels are beneficial and are known to be protective for the cardiovascular system. The nurse is assessing the lower extremities of the client with peripheral vascular disease. During the assessment, the nurse should expect to find which of the following clinical manifestations of PVD? Select all that apply. 1. Hairy legs. 2. Mottled skin. 3. Pink skin. 4. Coolness. 5. Moist skin. The correct answers are 2. Mottled skin and 4. Coolness. Reduction of blood flow to a specific area results in decreased oxygen and nutrients. As a result, the skin may appear mottled. The skin will also be cool to the touch. Loss of hair and dry skin are other signs that the nurse may observe in a client with PVD of the lower extremities.
The nurse is receiving a patient with peripheral vascular disease from the post-anesthesia care unit after a SIME amputation of the right lower extremity. At which level on this diagram would the nurse expect to find the amputation? 1A, 2B, 3C, 4D. The correct answer is 3C. Rationale. When a patient has a SIME amputation, most of the foot is removed but the ankle remains. Advantages of the surgery over below the knee include that the patient can still be weight-bearing and that there is less pain.
A client with colon cancer has developed ascites. The nurse should conduct a focused assessment for which of the following? Select all that apply. 1. Respiratory distress. 2. Bleeding. 3. Fluid and electrolyte imbalance. 4. Weight gain. 5. Infection. The correct answers are 1. Respiratory distress and 3. Fluid and electrolyte imbalance. Ascites limits the movement of the diaphragm, leading to respiratory distress. Fluid shift from the intravascular space precipitates fluid and electrolyte imbalances. Weight gain is not a direct consequence of ascites, but weight loss may result in decreased albumin levels. Decreased albumin in the intravascular space results in decreased oncotic pressure, precipitating movement of fluid out of space. A client with ascites is not at increased risk for infection unless a peritoneal tap is done to remove fluid. The risk of bleeding is a result of alterations in liver enzymes affecting coagulation. After a car accident, a patient with a medical alert bracelet indicating hemophilia A is admitted to the emergency department. Which action prescribed by the healthcare provider will the nurse implement first? 1. Transport the patient to the radiology department for cervical spine radiography. 2. Transfuse factor 7 concentrate. 3. Type and cross-match for 4 units of packed red blood cells. 4. Infuse normal saline at 250 ml per hour. The correct answer is 2. Transfuse factor 7 concentrate. When a hemophiliac patient is at high risk for bleeding, the priority intervention is to maximize the availability of clotting factors. The other prescribed actions should also be implemented rapidly, but do not have as high a priority as administering clotting factors. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The nurse is developing a plan of care for a client diagnosed with laryngitis and identifies the client problem, altered communication. Which intervention should the nurse implement? 1. Instruct the client to drink a mixture of brandy and honey several times a day. 2. Encourage the client to whisper instead of trying to speak at a normal level. 3. Provide the client with a blank notepad for writing any communication. 4. Explain that the client's aphonia may become a permanent condition. The correct answer is 3. Provide the client with a blank notepad for writing any communication. Voice rest is encouraged for the client experiencing laryngitis. Aphonia, or inability to speak, is a temporary condition associated with laryngitis. The client with laryngitis is instructed to avoid all alcohol. Alcohol causes increased irritation of the throat. Whispering places added strain on the larynx. Encouraging the use of alcohol, with the exception of a glass of red wine, is not accepted medical practice. Therefore, option 1 could be eliminated. Option 4 has an absolute, permanent, in it, and therefore could be eliminated from consideration. The client being discharged after sustaining an acute MI is prescribed lisinopril. Which instruction should the nurse include when teaching about this medication? 1. Instruct the client to monitor the blood pressure weekly. 2. Encourage the client to take medication on an empty stomach. 3. Discuss the need to rise slowly from lying to a standing position. 4. Teach the client to take the medication at night only. The correct answer is 3. Discuss the need to rise slowly from lying to a standing position. This medication causes orthostatic hypotension, and the client should be instructed to rise slowly from lying to sitting to standing position to prevent falls and injury.
A client with pernicious anemia asks why it is necessary to take vitamin B12 injections forever. Which is the nurse's best response? 1. The reason for your vitamin deficiency is an inability to absorb the vitamin because the stomach is not producing sufficient acid. 2. The reason for your vitamin deficiency is an inability to absorb the vitamin because the stomach is not producing sufficient intrinsic factor. 3. The reason for your vitamin deficiency is an excessive excretion of the vitamin because of kidney dysfunction. 4. The reason for your vitamin deficiency is an increased requirement for the vitamin because of rapid red blood cell production. The correct answer is 2. Most clients with pernicious anemia have deficient production of intrinsic factor in the stomach. Intrinsic factor attaches to the vitamin in the stomach and forms a complex that allows the vitamin to be absorbed in the small intestine. The stomach is producing enough acid. There is not an excessive excretion of the vitamin, and there is not a rapid production of red blood cells in this condition.
A client who has a history of mitral valve prolapse is scheduled to get her teeth cleaned. Which of the following replies by the nurse is most appropriate? 1. The physician will need to reevaluate the status of your heart condition before your dental appointment. 2. Be sure to remind your dentist that you have a heart condition. 3. It is important for you to care for your teeth because your heart condition makes you more susceptible to developing oral infections. 4. We will prescribe a prophylactic antibiotic for you to take before getting your teeth cleaned. The correct answer is 4. We will prescribe a prophylactic antibiotic for you to take before getting your teeth cleaned. Clients who are at risk for developing infective endocarditis due to cardiac conditions such as mitral valve prolapse must take prophylactic antibiotics before any dental procedure that may cause bleeding. The client is not more susceptible to developing oral infections. Rather, the client is more susceptible to developing endocarditis that results from oral bacteria that enter the circulation during the dental procedure. The physician does not necessarily need to reevaluate the heart condition of a client who is stable, but antibiotics must be prescribed. It is not enough to simply remind the dentist about the heart condition.
Which of the following is an expected outcome when a client is receiving an IV administration of furosemide? 1. Increased blood pressure. 2. Increased urine output. 3. Decreased pain. 4. Decreased premature ventricular contractions. The correct answer is 2. Increased urine output. Rationale. Furosemide is a loop diuretic that acts to increase urine output. Furosemide does not increase blood pressure, decrease pain, or decrease arrhythmias.
You can get the NCLEX Mastery Bundle now. Link is in the description, or you can get it at alphanurseguide.com.